and stroke. So we want to absolutely maximize your chance of never having a heart attack, never having a stroke, and making sure that the blood pressure elevations don't affect the ability of the heart to function as a pump and to keep beating blood through your circulation and support the brain and the viscera in an adequate way. So that's the first thing. The second area is cancer, and that, of course, has been a major concern. For women, there are 9 cancers that we worry about. So breast, lung, and colon are the first 3. The middle 3 are the visceral, lymphoid, and leukemia. The visceral includes hypernephroma, pancreatic cancer, liver cancer, and things of that sort. Those are the visceral cancers, and then lymphoid and leukemia. And the last 3 areas are the cervix. These are the pelvic cancers, the cervix, the endometrium, and the ovary. So following our protocols, the chance of you having any fatality from these 9 cancers is diminished. Our protocols are, number 1, for early detection, but even more important, we have protocols for prevention. For instance, Jackie Kennedy, healthy woman, but she came down with lymphoma, non-Hodgkin's lymphoma, and died. We believe that our protocols, number 1, could have detected it at an earlier stage, but even more importantly, could have prevented her from getting it in the first place.
Those are good words.
Yeah. So the third category is diabetes, insulin resistance, and also for people who are overweight. That's the third category. So diabetes, obesity, and insulin resistance. And in the United States, that's an epidemic. We now know that even thin people like yourself can have insulin resistance and can have pre-diabetic states. Okay? So that's the third area. The fourth area is the sex hormone-related conditions.
I just want to say anything.
What we can ask?
My brother, who's 75, when he was 70, and he's very slim, came down with diabetes.
Insulin dependent or non-insulin dependent?
He was non at first, now he's insulin dependent.
How old is he right now?
He's 75.
75. Well, that's important. And let me just, we don't have that in the history here. So basically, this is the evaluation. We start this at the age of 45 for all women, and we believe that this is the approach. The fourth and last category is the sex hormone-dependent disorders of the body. And what are the things we're worried about with the sex hormone-dependent issues?
What are we worried about?
We're worried about your bones, osteoporosis.
I wasn't even thinking of bones. Okay.
We're worried about your brain, memory loss, so Alzheimer's disease. That's a sex hormone-dependent condition.
Really?
Mm-hmm.
Awesome.
The third area is hot flashes and sexual function. And that includes how well the bladder functions, how your urination is, loss of urine with incontinence. So this is the genitourinary tract. So you see there's 7 areas, 1, 2, 3, 4, 5, 6, 7. Those are the 7 conditions that we're concerned about for your general health. Now, that is an overview of what the universe of problems are. Okay, so that sort of completes part 1.
Awesome, and this is in regards to preventive medicine.
Lifespan medical.
Lifespan medical.
How we can give the maximum lifespan to people.